Still news from the health world. The Indonesian Ministry of Health, the United Nations Development Program in Indonesia, in collaboration with World Health Organization, today signed a joint commitment to implement a project funded by Green Climate Fund, an ambitious global climate and health investment initiative. Here's a full interview of TVRI World reporter Alma Safitri with UNDP about this collaboration.
The United Nations Development Program, or UNDP, World Health Organization, or WHO, and also the Indonesian Ministry of Health have inaugurated the Green Climate Fund, a project to build Indonesia health system resilient to climate change, which could be significantly beneficial, with projection in climate-related health risks such as dengue fever, tuberculosis, and malaria transmission. And to know more about this program, joining me now, officer in charge at UNDP Indonesia, Sujalapan. Hello, good afternoon, and thank you for your time today. So the first question is, can you please tell us a little bit about Green Climate Fund program, that a collaboration between WHO and Indonesia Ministry of Health?
Sure. Thank you so much, and we're very excited to be here at this, the kickoff of the discussions around this program that's related to the resilience of health system to the impacts of climate change. At the outset, I would like to say that this is part of a global program that the Green Climate Fund has agreed to and decided to finance, and it will cover 17 countries, and one of which is Indonesia. So WHO, the World Health Organizations, the United Nations Development Program have come together with the Ministry of Health to look at what this would mean for Indonesia. So before even getting to where we are today, actually there have been discussions with our partners within the Health Ministry to see if there is an appetite for this kind of work to be done. I'd like to take you back to a few years during the Conference of Parties 26, COP26. There was a commitment from a number of countries that health systems need to be more resilient to the impacts of climate change, but at the same time, they also need to take into account the health sector's sort of negative effects to the climate change, whether it's from greenhouse gas emissions or other effects. So in a way, this program is about helping to translate that commitment that was made at COP26 into a concrete way forward. And it's different for different countries. So the discussion we're having over the next couple of days is really to identify how and what Indonesia and Indonesian stakeholders want to focus on in the context of this global program. And already it's a narrow field. We're looking at how to enable and leverage additional financing to enable the kind of changes that we need to see to shift from a highly intensive GHG emitting sector to something that can reduce those effects, while at the same time also considering how the impacts of climate change that individuals and communities are facing can also be better managed, anticipated, and responded to.
So the first one, UNDP in Indonesia initiates this program. How's Indonesia government response, especially Minister of Health?
Well, first of all, UNDP, like most of our partners, like WHO as well, we only work and bring forward proposal if there is an interest of any ministry or any Indonesian partner. And here, of course, there was an interest from the Ministry of Health because the healthcare economy is very important. The investment in human capital is very important, and if the health of communities and populations are negatively affected, we do need to take that into account. So there was definitely a positive reaction, which is why we've taken it forward to this stage where we're looking now at really specifics, needs, decisions around where the project will be implemented in Indonesia. What are the specific areas of focus within this project that should be identified, because that is not something that we do as UNDP. This is very much a co-creation and thinking of a solution forward together. Otherwise, if we don't have that ownership, then it won't really be sustainable. So the response so far has been positive.
So according to Mr. Budi, there is so many health tasks in Indonesia that caused by climate change. So that will be another program besides Green Climate Fund in Indonesia?
Absolutely. I mean, Indonesia, first of all, it's a vast country. And the resources that are coming with this project is really kind of a way to kickstart a response in a very specific area, which is about catalytic funding. But of course there are health priorities, right, with or without climate change. And just to give you an example, UNDP has been working for many years now with the Ministry of Health on looking at how do we better prepare for pandemics. Because when COVID-19 happened, not just Indonesia, but no country really was ready for that, right? And we know that the ability to respond to a crisis needs good planning. We don't want to be in an emergency mode all the time. So a lot of the work that we're currently doing with the Ministry of Health and our partners in the health sector are around better surveillance system, looking at how we can use the power of digital technologies to better predict what type of diseases might be coming up, and therefore how can we address them. So that's one aspect. Another area of work is through our partnership with the Global Fund for HIV, AIDS, TB, and malaria. So in that response, we're also working with the Ministry of Health and various structures like the country coordination mechanism to make sure that the efforts needed to have a positive impact on malaria, on TB instances in Indonesia can be brought down, not from sort of the medical perspective that a WHO would bring, but really looking at it from a systemic process, looking at logistical supply systems, looking at vaccine distributions, etc. So there's a lot to do. We are only one part of the puzzle, and the GCF project that we're talking about today is also one aspect of many different things that are needed, of course.
Thank you so much for your time, and so we hope that from this program, UNDP and also WHO in Indonesia will give so many benefits for Indonesian people, especially in health sector. Alma and camera person Danu reporting for TVRI World.